Good morning, everyone. Happy holidays. Welcome into a brand new edition of Sports Medicine Weekly on this Sunday morning. So happy you're with us. I'm Steve Kashul, joined by my usual co-host, Dr. Brian Cole. He is the head team physician for the Chicago Bulls, one of the team physicians with the Chicago White Sox, sports medicine specialist, orthopedic surgeon at Midwest Orthopedics at Rush. Our website is sportsmedicineweekly.com. We also always have podcast segments available to hear on the Sports Medicine Weekly blog, also through Apple, Google, Spotify, Pandora, YouTube, iHeartRadio, and wherever you get your podcast audio. And our producer, as always, is Shane Reardon. And Dr. Cole, how are you on this Sunday?
Steve, I'm doing great.
Good.
Great to talk to you.
Absolutely. I'm going to start right into our pro athlete injury of the week. Although this week we spotlight a possible future NFL player, Alabama starting center, senior Landon Dickerson, who will be unable to play in the college football playoffs after suffering a season-ending knee injury in the SEC championship game victory over Florida last weekend. Alabama coach Nick Saban saying only it's ligament damage. So tell us about the timing of something like this. We're not sure if he has a fifth-year eligibility at Alabama. Saban is keeping it close to the vest, but you would think that he's headed for the NFL draft.
Yeah, I mean, Steve, it's unfortunate. They think, they're coming towards the end of the season, and his next steps, most likely, I would imagine, would be coming out in the draft. And I think that, part of it is when you're strategically as a young athlete like this, you have to contemplate, what am I going to do in the timing? Let's just assume we don't know what the injury is, and I'm sure we'll get some more information in the near term. But if it's something that's got a long recovery associated with it, these athletes are often in very difficult positions. If they could have a medical red shirt, they'll be thinking to themselves, look, I'm going to get this fixed, and then I'm going to come back and play another year so that I can show that I have value. The flip side is, depending on the injury, they may say, look, I'm going to get this fixed, and I'm coming out in the draft. And the one challenge with that is, one of the things we've learned about risk assessment in managing athletes who are coming out in the draft in any sport is that the past can be a good predictor of the future. So if you've got any amount of time behind you after you've either had surgical intervention or you've just recovered from an injury, any amount of time behind you, Steve, can sort of predict what's going to happen going forward. So having the ability to demonstrate play and performance and the absence of recurrent symptoms is really important sometimes to sort of validate an individual's sort of, if you will, better, like their asset value per se. So it all depends upon the nature of the injury and the statistical likelihood of it coming back, and how steadfast a team might be in saying, look, you have no track record. I don't know if you're going to get back from this injury, if it's that type of injury, or we know these things typically recover and we're willing to take our chances. I think always the safest bet, but may not be always the best bet, is to say, I'm going to go back and play and demonstrate my ability to play. But, agents and players will have different views on that. They'll say, look, we're going to go out and we'll take our chances here. So the short of it is unfortunate for anyone to get injured like this, and we'll hope the best for him that this is not something that's going to be associated with a prolonged recovery or in any way will compromise him when he gets back to sport.
Okay, let's move on.